morning all. Today we are starting with the anatomy of retina. Later we are going to physiology. And first, structure of fovea centralis. In foveal region, we yesterday already discussed that there are no rods. Cones are there. Cones are larger in fovea and in abundance and tightly packed. And other layers of retina are very thin in this area. And in central part, that is foveola, it consists of largely consists of cones and their nuclei covered by a thin internal limiting membrane. All other retinal layers are absent, and in foveal region surrounding the foveola, the cones axons are arranged obliquely. That is, it's known as Henle's layer there to reach the margin of fovea. The ganglions layer in there are 2 to 6 layers thick. And next, blood supply of retina. Outer 4 layers of retina, that is pigment epithelium, layer of rods and cones, outer limiting membrane, and the outer nuclear layer. They getting nutrition from choriocapillaries. And the inner 6 layers, like outer plexiform layer and inner nuclear layer, inner plexiform layer, layer of ganglion cells, nerve fiber layer, and internal limiting membrane. They getting nutrition from central retinal artery. And outer plexiform layer, they get blood supply partly from the central retinal artery and partly from the choriocapillaries by diffusion. Fovea, it's an avascular area mainly supplied by the choriocapillaries. Macular region gets its blood supply by small twigs from the superior and inferior temporal branches of central retinal artery, and sometimes cilio-retinal artery is originating in a hook-shaped manner within the temporal margin of the disc, and it's run toward the macula and supplies it. Thus, when present, it helps retain the central vision if in case of central retinal artery occlusion. And retinal vessels are end arteries, that is, they do not anastomosis with each other. But anastomosis between retinal vessels and ciliary system of vessels exit in the neighborhood of lamina cribrosa with the vessels which enter the optic nerve head from the arterial circle of Sinoaler. This arterial circle is formed by an anastomosis between 2 and 4 or more short posterior ciliary arteries and lies in the sclera around the optic nerve. And from it, numerous branches pass forward to the choroid, inward to the optic nerve, and backward to the pial network. Branches which pass inward lamina cribrosa and also send branches to the optic nerve head and the surrounding retina. Next, central retinal artery. It's the first branch of ophthalmic artery, and it's arises near the optic foramen and course ahead with the 5 to 6 right angle bends as follows. Like outside the optic nerve, it runs a wavy course forward below the optic nerve but adherent to the dural sheath to about 10 to 15 millimeter behind the eyeball. At a point along the infromedial aspect of the nerve, it bends upward to pierce the dura and arachnoid. From both of which, it receives covering. In the subarachnoid space, it bends forward and after a short course, it again bends upward at nearly right angle and invaginates the pia to reach the center of the nerve. The entering vessel is clothed by the pia along with the pial vessel. It also surrounded by a sympathetic nerve plexus. It's known as nerve of Tiedemann. In the center of optic nerve, the artery bends forwards and then in company with the vein, which lies on its temporal side. It passes anteriorly and pierces the lamina cribrosa to appear inside the eye. In the optic nerve head, it lies superficially in the nasal part of physiological cup, covered only by that layer of glial tissue which closes the physiological cup. Here it divides into two branches, superior and an inferior branch, and then it subdivides into a temporal and that each branch subdivides into temporal and a nasal branch at or near the margin of the optic disc. Then in retina, 4 terminal branches of central retinal artery like superior nasal, superior temporal, inferior nasal and inferior temporal. They divide dichotomously as they proceed towards the ora serrata where they end without anastomosis. Then arrangement of retinal capillaries. The terminal, they are the terminal fundus arterioles. They bend sharply and dip almost vertically into the retina, forming the capillary network arranged as follows, like superficial capillary network and deep network. In most of the extramacular fundus, there are two retinal capillary network, that is superficial and deep. Superficial lies at the level of the nerve fiber layer. We can see this is superficial capillary network, and the deep network lies between inner nuclear layer and the outer plexiform layer. The deep capillary network is more dense and complex, and there are anastomotic capillaries which run from one to another. Peripherally, as the ora serrata is approached, the capillary network is reduced to scanty as a single layer. In parafoveal zone, the capillary network is well developed. It's 3-layered and exists a capillary free zone in the fovea, known as foveal avascular zone. It's about 500 micrometer in diameter. And in the peripapillary region, the capillary network becomes 4-layered and support the extremely thick nerve fiber layer characteristic of this region. These are the pictures of vortex ambula I included today, and here we can see in this picture the 4 vortex ambula is marked in this picture, and this this circle corresponds to the area of equator, and this arrow also showing vortex vein. It's indocyanine green angiography showing vortex ambula images. This arrow is showing. This is vortex vein varicosity in infranasal quadrant. Here we can see. And this is a picture of myelinated nerve fiber layer. The myelination is there. The light won't pass to the pigment epithelium and layer of rods and cones. So the transmission is hindered if the myelination is there. So the retinal nerve fiber layer is unmyelinated. That's all. Thank you. Next, we will continue with the physiology of retina. Sonika will start the class.
Shilpa, and just you stop your sharing the screen.
Okay.
Good, Shilpa. So meanwhile, she changes her slides. Can you tell me in any one condition where the foveal avascular zone, you do find some amount of bleeds or hemorrhages?
Sir, that is cherry red.
Avascular zone is lost.
Cherry red spot, sir?
No.
Sir, in PDR, sir?
Yeah, in diabetic retinopathy, you do find that. Foveal avascular zone also increases can you just tell me in which condition that FAZ increases?
Increases height in
So basically, foveal avascular zone is area where there is no vascularization.
vascular. Sir,
So
then
in ischemic
shock.
conditions, what did you say?
Shock, sir. Hypovolemic shock.
In ischemic conditions, you usually find the foveal avascular zone increases.
Sir.
So like vein occlusions.
Sir.
Any vein occlusion that you know?
Central vein occlusion, sir.
Not exactly central retinal vein. Any other?
BRVO, sir, retinal branches vein occlusions.
Okay, there is another variant in BRVO where the foveal avascular zone is enlarged. You can change your slides. You can put your slides up. Any idea, both of you? In branch
It
retinal vein
supplies
occlusion,
the area, like the macular area that vein occluded, then a vascular zone enlarging.
exactly. So what is that condition called? It's a variant of BRVO.
Foveal veins, sir. Macular.
It's called macular BRVO.
Okay, sir. Okay,
Okay,
sir.
anyways, further in your vein occlusions, you will get to know about what kind of what is it exactly. So just remember that FAZ increases in macular vein occlusions, BRVO, especially in macular BRVO.
Sir.
Okay, so you can start.
Is there any significance of that arterial circulation and flame-shaped hemorrhages, deep hemorrhages?
Yes, sir, I didn't get you.
Flame-shaped hemorrhages.
Yeah.
That will happen. That will be there when the hemorrhages are there in the nerve fiber layer, no?
Yes.
Yeah, that is superficial circulation. No?
Superficial layers.
Deep circulation.
Because of the arrangement of nerve fiber layer, bleed takes the shape of a flame shape. Those are superficial hemorrhages.
Shall I start, sir?
Yeah, start, Sonika.
Good morning to all. After the anatomy, let's start the physiology of the retina. In this four headings, our headings just to discuss the metabolism. First, we discuss the metabolism of the retina, then absorption of the photons, photochemical physiology of the retina, neurophysiology, electrophysiology, and vascular physiology of the retina, and the last is the visual pathway. For any function, physiology, that means we are understanding about the how the retina function. So for any function, we need some energy. So for that, metabolism is necessary for in that part, and the main source of this metabolism sources, that is the glucose, carbohydrate, and some is the lipid, and also vitamin, minerals, and oxygen. That's all are mainly the main supplied by the capillaries of the choroid. Capillary of the choroids and the central retinal artery mainly, and some from the circle of the gene, as discussed in the, that is the arterial circle around the nerve